Hello, this is Rachel Eblin, and today I'll be presenting on healthcare policy and law. The federal government has the responsibility to take care of its people, and part of that responsibility includes creating healthcare policies and laws that will benefit the people. With rising costs over the years, the federal government has had to come up with ways to avoid waste and slow down spending. In this presentation, I will be going over the role healthcare policy and law has in society, problems with policy and law, and why policymaking is needed. So what is healthcare policy and law? According to the World Health Organization, health policy refers to decisions, plans, and actions that are undertaken to achieve specific healthcare goals within a society. Healthcare policies can either be legal measures or they can be put in place by an organization based on that organization's views. An example of a healthcare policy would be prohibiting tobacco and alcohol use at work. Geisinger Medical Center in central Pennsylvania has a policy where they do not accept applicants who use nicotine products. Geisinger implemented this policy with the goal of reducing healthcare costs due to smoking and absenteeism among employees for health issues related to smoking. Healthcare laws are rules and regulations that must be followed by all citizens compulsorily. One example of a healthcare law is the Health Insurance Portability and Accountability Act of 1996. This law outlines the appropriate use of protected health information. Healthcare organizations use the HIPAA law as a guideline to create their own policies and required training for employees. These policies include all of the information set forth by HIPAA. The next is the policy law and lawmaking process. Each state has 3 branches of government. The appointed governor is the head of the state executive branch and can set policy. States can regulate healthcare issues such as provider licensing, accreditation, and public health concerns. Policies in each state can differ because every state has their own specific priorities that need to be addressed. Organizations have their own priorities as well, so this will determine what policies they put in place. At the federal level, Congress has the power to create laws under Article 1 of the U.S. Constitution. Congress is made up of 2 chambers called the House of Representatives and the Senate. When a member of Congress presents a bill, it is assigned to a specific committee. If the majority of the committee members approve the bill, it moves to the full chamber of the House or the Senate. If the majority of both chambers agree with the bill, it moves forward to the president, who then has the ability to sign it into law. The stakeholders in healthcare are policymakers, payers, patients, and providers. Policymakers are those individuals who create healthcare policies and laws which determine important factors such as who can receive care, what services are provided, and how healthcare services and programs are paid for. Payers are also influenced by healthcare laws. The Affordable Care Act forbids insurance companies from denying citizens coverage or charging them more for having pre-existing conditions. Patients are the ones receiving healthcare services. Healthcare policies and laws affect the cost of their care, the access, and quality of care. The Healthcare Quality Improvement Act of 1986 was enacted to reduce medical errors and protect the public. Providers are involved in treating patients, and there are many laws that govern what they can and cannot do in healthcare. One example is the False Claims Act. This act places liability on individuals who try to defraud government programs such as Medicare and Medicaid. Common violations in healthcare include upcoding for medical procedures and performing or ordering of unnecessary procedures. Next, I'll go over the importance of healthcare policy and law. Interventional public health laws are put in place to aid in improving health outcomes in the community and can lead to reduced healthcare costs. A public health policy that I previously mentioned was the Geisinger no smoking policy. Each state has the ability to create their own vaccination laws as well. Vaccinations can help reduce and eliminate diseases and protect individuals with weakened immune systems, such as children who are too young to receive certain vaccines. The federal healthcare spending budget can have both positive and negative impacts on citizens. The fiscal year 2020 budget for healthcare spending includes some positive initiatives such as using $20 million in federal funding to treat opioid addiction and $6 million to increase access to school-based mental health treatment. The budget included cutting funding for the Produce RX food program, which allowed food insecure patients to receive prescriptions for fruits and vegetables. With the rise in opioid overdose deaths, some states have implemented legislation that limits first-time opioid prescription or drug monitoring programs to reduce the instances of misuse and addiction. Like I mentioned earlier, the government has a responsibility to protect its citizens, and addressing this epidemic with drug regulation is a good step to protect people from addiction and help those who are currently misusing opioids. Next, I'll go over some problems with policy and law. The Affordable Care Act has many positive aspects, but there are some issues that have come to light since it was signed into law. One con of this law is that it has increased insurance premiums due to the fact that insurance companies had to offer a wider range of services under their plans. Businesses also started cutting employee hours because the ACA required businesses with 50-plus employees to provide employee health insurance. The medical device tax was put in place in 2013 and applied to medical devices such as X-ray machines, MRI machines, surgical tools, and pacemakers. Between 2013 and 2015, the medical device industry saw a reduction in spending by $34 million and the loss of over 20,000 jobs. These are just a few examples, but there have been many other lessons learned from healthcare laws. In conclusion, most healthcare policies and laws are put in place with the goal of protecting and benefiting citizens in the United States. Policies and laws can both promote health and increase access and quality of care that people receive. A lot of people would be negatively impacted if we didn't have the healthcare laws that we have today. Thank you for listening and have a great day.